at later dates. So if you see something that you like here, you can request presentations from me or the presenters. We'll be happy to send you forward, but those trainings will also be recorded online. So today is our first learning community call of the grant cycle. I just want to congratulate all of you grantees on your implementation plans, getting those done. I know this new Prop EE funding is another kind of heavy lift that everybody's doing. Appreciate that as well. And just really excited to get this year started. You know, we work in a very difficult subject matter. It is very difficult. If it were easy, it would already be done, correct? So we're in a process of really building this plane and making it sustainable and really finding on-roads. We don't do that. We do not do that by alone. My thought process doesn't do it. So I represent Colorado. There's a whole bunch of counties in Colorado, and they're all uniquely different. And I love that. The rural areas and the metro areas, they're all very different. So the same process isn't necessarily going to work for everyone. And that's why I don't hand you a template and say, here's what you need to do. Now, I will hand you best practices and I will hand you suggestions and recommendations, but I don't work in your public health. So what we really want to do is to support you in building out a process that's going to be sustainable, that when you leave, a new person will come in and be able to follow it without any lag of services, right? Because your process is so clearly defined. So that being said, I do want to just share with you the agenda for today. Okay, so here's what we're doing. We're going to welcome, we're going to go over the meeting objectives, which we're doing right now, and I'm going to share the equity statement here a little bit. 10:15 to 11:30, we're going to talk about developing the process. 10:30 to 10:45, Boulder's going to share their process, and then Pueblo is going to share their process, and then we'll have a little Q&A session. I am hoping that we have time to see, I'm talking and I'm not sharing my window. I'm hoping at the end that we have time to do a little bit of a group activity together in breakout rooms. So we'll see how that goes. Depends on the presentations, and I definitely want you guys to ask questions. And then we're hoping to wrap this up at 11:30. We only have 3 objectives today. One objective is to share the resource process, the processes. Sorry, I guess I have 4 objectives. I don't know where 2 is. Sorry, my agenda is not great. But we wanted just today, we're just going to stick on the process because we have a series going on. So we don't want to start at the end and work our way back. We're going to start at the beginning. So that being said, I do want to just share a little bit about equity in this work. During the training, I think our equity has been a little bit skewed because with reason it should be, because in equity, if we follow the 5-step process and that leads to someone being evicted, then someone loses their housing. So that is a concern, right? I mean, we really don't want that to happen. And that's why we have to put so many supports in place. But we want to remember that, you know, equity is health and safety for all. It's whether it's secondhand smoke or thirdhand smoke, that we know that it affects vulnerable populations. Now that's children and elderly and people with pre-existing health conditions like asthma and heart disease. They're mostly exposed in multifamily housing. So we have to address this inequality because we know that low-income communities and communities of color are often more exposed to secondhand smoke, and they have less resources that support smoke-free living. So we want to look at inclusive implementation. So this means our approach to implementing smoke-free policy is rooted in inclusivity and respect. That means communication with the communities. So we believe in engaging with the residents through education, resources, and support that help them transition to a smoke-free environment. This includes providing access to smoking cessation programs and ensuring that residents are fully informed and involved. We are committed to making these transitions as smooth and supportive as possible, recognizing that our community members' diverse needs and experiences. We're advocating for a healthier future, guys. So this is our role. This is the equity in it, right? Equity for all, smokers, non-smokers. We want clean indoor air for housing. So that being said, we're going to move right into the process. I am going to share. I know you all probably cringe every time I share my screen, but stay with me on this one. Because today we're going to talk about, let's see, this. So secondhand smoke complaint process. Now, I shared this in a workshop, I think 2 years ago. We talked about what does it look like, and this is really simplification. And I love 5 steps, and I love things that start with the same letter. So here you go. We receive the complaint, we research the complaint, we reflect on what the complaint is, we respond, that's misspelled, and we report out. So this is the process that we're going to be talking about today. And let's see, one more thing. And then don't forget to our 5-step process. So we have that too. Make sure that you guys are aware of that process. Tobacco Free Colorado has our resource packet, and all this is in that. So so be sure to check that out. Okay, without any further ado, I want to introduce our speakers, our presenters for today. First, I'm going to start with Boulder County. And Boulder County has been one of the strongest counties in multi-unit housing since I've been involved in this program. When I started, there were some really heavy hitters there, and they really established some pretty great things. And one thing that they were always concerned about, and they always highlighted, was HOAs are an issue. We're still doing that. You know, we're still doing that. But the Boulder was the first one to say, what about HOAs? And so we're still not there. You know, and that's been 5 years. So, but they're growing. And I just wanted Alberto to jump on and share his process with you and everything that he's created. So without further ado, I'm gonna invite Alberto from Boulder County to share his process and where he is. Now, remembering, guys, Boulder and Pueblo were previously funded under 2.1 strategy. So they've done more work. So if you're not Boulder, Denver, Jefferson County, what used to be Adams County, not anymore, they were the only people funded. So they should be the only counties that are really ahead of the game in this. So we're not expecting all of you to have these processes built. Even the processes that were built are now being refined. So without, I'm going to shut up now. Alberto, go ahead, share your screen, take over the wheel.
Thank you so much, Peggy, and good afternoon, everybody. I think you should be able to see that shortly. And great, thanks for the head nod. My name is Alberto de los Rios. As Peggy said, I use he, they pronouns. I'm a bilingual community health specialist at Boulder County, and I wanted to go over a little bit about our processes. And I want to preface that while this has been a long time in the making, it's imperfect, and that's okay. Every single case that you have is unique in its nature, and it's important to take the time to reflect. And I know that that can be constrained because of staffing, because of resources, and we have TAs like Peggy that can support you, and your other TAs that can provide insights on this. So I'll quickly go over our tracking process, our data repository, our general process, and then I'll maybe leave some Q&A, or Peggy, if you want to leave that for later, I'll leave that up to you. So
I want you to go ahead with the Q&A, and I want you to take your time, and I want you to, I've given you time, so don't feel rushed.
Thank you. So I know that what you see on the screen right now can be a little bit overwhelming. And this is a way for us to keep every single detail that we get from our complaint process. It usually, once we receive complaints from the state, we have some of these items already laid out for us. And also we keep an entry ID. We also, it's a way for us to communicate, say, if I were to leave or somebody else in our staff were to begin, they could see everything in fine detail and they could be able to catch up in no time. It is a way for us to maintain this in perpetuity regardless of staff knowledge ebb and flowing. So we describe the town, the type of complaint. We usually keep a description from what is found in the form. We also describe the type of housing, the addresses, and I removed some of the personal identifiable information for the purpose of this presentation, but we usually also keep that as part of the tracking process. And then we keep this is also a way for us to communicate with each other to say, on this date I sent an email, on this date I went ahead and share this with the complainant. This is when I sent the letter. If we received any correspondence from our TA, such as Peggy, we also bring that into the action steps or into the memos and the notes. And it's just a way for us to keep as much detail as possible in one single place. And we also attach hyperlinks in the complainants folder. So if there's any need to refer to letters, to saved emails, we have it all in one place. We also use Microsoft Teams as a way for us to keep a repository of everything. So we have a general tab channel, and this is where we usually have a folder for secondhand smoking. So we have it divided as complaints, communications policies, resources, templates, you name it. And then we classify it by fiscal year. And then from then we have coding for everything. As you see on the right hand, I've removed all personal information, and yet we have the address, the name of the apartment complex, just a way to keep reference. And within there, we have our draft letter, our saved PDF letter, and we also save in a PDF all email correspondence that we have with the complainant or any parties involved. This is also, I'm not going to go over this because this is quite complex. And also I wanted to show you, this is a general way of us to understand our process. Where do we start usually when we receive a complaint? And then based on the type of complaint, we log it and we assess what the next steps. So it can change whether it is a business, whether it is a public space, whether it's multi-unit housing, and whether it is a public multi-unit housing or private multi-unit housing. So we have different potential steps for follow-up. And then as part of that process, we also have hyperlinks that we attach, say if we want to reference any policies, if we want to reference materials, templates, letters, and whatnot. In general, we have written steps in detail. As I said before, it's important for us to have everything written, everything available for staff. Should somebody else join the team or somebody else leave, everything remains in place. So we walk through the process in detail of what to do when we do an intake for the complaint, how to conduct a site visit, what are some of the safety considerations that we need to have, what are some of the next steps that we should take into place, how you can write a letter. You know, we have a letterhead, how to mail it, how to follow up, and how to close the case. Because sometimes, and this is something that I've done with Raya McIntyre and Peggy a lot, is some of the cases will not be able to be solved by TEP at the local level, and sometimes it is out of our control. We've exhausted all of our resources, and we follow a protocol as well to say we've elevated this case to the state. We need to establish a boundary. We no longer can support you. We are very sorry about that, and we hope that your case can be solved through other partners. And this can apply sometimes with things that go beyond secondhand smoking for tobacco, such as marijuana, or it can be also by exposure to meth or other air contaminants. So also we'll bring in back what Peggy said earlier about our 5 Rs for the complaint process. So these are some of the things that we keep in mind as we receive things. Make sure that we collect everything and we have one spot so that you're not scrambling in your email, in your Outlook, or make sure that there's no backlogs for complaints. When we research, ask yourself questions such as, is this part of a previous larger case? That's why it's good to have a database with the complainant's name, with the addresses. What are the factors at play? Again, is it multi-unit housing? Is it private? What are the policies in place? Who should be involved? Sometimes you might need to have environmental health and your public health department involved, or sometimes you need to have municipal partners, you need to have law enforcement, and what support do you need from TAs and management? It's okay to ask for help. So Peggy has been so resourceful and so supportive in the process, and also my supervisor, if there needs to be an instance where we need to talk to a third party or somebody, when we reflect what is the best action step and take, we want to respond to these things promptly, and also we don't want to rush it so that we don't miss an opportunity to either do some shared learning, to do an opportunity to build rapport if it's an HOA, or if it's a multi-unit housing development, and always look into policies. Make sure you're keeping up to date with local policies, because that will add strength to the letters. Again, because we cannot enforce, it is important to say these are the things that you're falling under, be it local or county policies beyond the state CCIAA. And then, yeah, what support mechanisms? So can these complainants or the people affected be connected with other resources in your community? So when you respond, make sure you're always keeping the complainant up to date. It is important to also maintain confidentiality when necessary to prevent retaliation whenever possible. Also, take steps to protect staff's privacy. Make sure you're not sharing personal phones, because sometimes complainants will need to have somebody to talk to, and sometimes they do not respect work hours. So it's important for you to create your own mechanisms to say it is important that we talk only via email during these times and these times, or for you to not respond. And I know that sometimes it can be very daunting to say, well, I want to make sure that this person is doing well, they're going through this. And also it's important for you to understand that the limitations, and for you to not lose sleep unless it's an emergency. And yes, that can be elevated to the state. If it's truly an emergency, law enforcement can be called, or 911 can be called. So make sure you discern how you can create those steps to maintain that safety for you, for the staff, and for the complainants. Keep everybody in the loop. CC people, BCC people. Make sure you're keeping people updated. Be your TA, your supervisor, your coworkers. It's better to send an email and keep people in the know, just as an FYI, than not, so that you don't have to catch people up in the process. And it's always good to keep a list of resources. Are there any testing devices or any testing resources that are available in your local county or municipalities? What other things? Are there mediation services? Are there anything that can support the client and the complainant in the long and the short term? And then reporting, always keep everything up to date. One of our rules of thumb is save everything in a PDF. Save all email correspondence in a PDF, upload it to that specific cases folder, so that anyone can just click and see what was said, what the correspondence was, and update. And I always, if anything, let Peggy and Raya know, hey, by the way, this happened, just so you know, this is what this action steps we took. Or even before we take action, it's like, what do you think of this, if we don't have a clear pathway moving forward? And I also want to say again that this is an imperfect process. We're building it as we go. It is taking a lot of reflecting, a lot of conversations, and that is okay. It's not a perfect process. Again, one of the limitations that we have is because we cannot enforce things, we always have to orient ourselves around other people that can do enforcement. And it's important to also be clear as to our limitations. So one of the things that we always have issues with are HOAs and housing authorities, that it's always inconsistent across municipalities, across counties, even within the same county. Everything can just vary from department to department. Local enforcement, that could be police, that could be other legal pathways. Everybody has different processes. And we've recognized that sometimes, should somebody need meth remediation or other services that pertain to air quality within a multi-unit housing development, it can be tedious and it can be confusing. So it's okay. It's important for us to also recognize, okay, these are the loopholes that we're seeing, and how can we be proactive in the long term to say, let's streamline this to make it easier both for staff and the public. And developing partnerships is so important. So to know, okay, who do we respond to? How can we, at the public health department or the environmental health division, have all these systems in place so that we know, okay, if this person is needing a healthy home assessment, this is who they contact, this is the number, this is the website. If they need additional testing or they need any other resources, we can be that point person. Because sometimes the reality is that a case might not just necessarily be about secondhand smoking. It could also be that there's other issues. So it's important that as public servants, in my opinion, that we can direct them to the right person. Even if we don't have an answer right away, we can be proactive to say, we'll find somebody who can support you in this process now and in the future. And solutions are not always crystal clear. Things are nuanced. Life is complex. Cases are complex. So it's important to bring in the conversation, say to Peggy, we've bounced so many times with Peggy about, okay, this is happening. This is what we're dealing with. This is not crystal clear. we see that there's no solution pathway for this. How do we move forward with our limitations? And always ask for support. It's better to have a conversation than not. I feel empowered to know that there's no wrong question, or there's no wrong answer either. So it's just being graceful with each other, and also understanding that, the public will have different needs, and we're trying our best every day. So that was kind of just a general overview. Happy to answer any questions that you have, and thank you so much for having me here today.
Thank you so much, Alberto. That was a wonderful overview of your process. And I've been working with you, so I know how long and hard you've been working. And I love that you just started on the first day. You were just like, hey, what do I do? How can I do it? Kudos to you and your team out there in Boulder. And I know Casey has had an integral part in your advancement as well. I just want to open it up. I want to take just a quick moment. I want to open it up to Q&A, but before we do that, for you, Alberto, I want to, after we do a little Q&A, or even in between, if Pete and Raya could just jump on, show your face, and say hi. I know, Pete, I saw that you shared my free housing. If you want to share that out loud, I'd appreciate that. And then Raya, do you want to just show the folks your face so they know who all these emails are coming through to? And then we'll jump back to Alberto's questions. We'll give you all a minute to kind of formulate what you have to know. Raya, do you want to start? I don't know. Raya's got a baby. She may be doing something that can't be on camera.
I'm currently nap trapped, so so please forgive the casualness of how I look right now, but somebody didn't sleep last night, so we're getting sleep now. My name is Raya McIntyre, and this is my son Noah. Nikita, that's so sweet of you. I am the smoke-free policy specialist at CDPHE. I work alongside Peggy and Pete, and I go my scope is a little bit bigger than Peggy and Pete. They focus primarily on multifamily housing. My focus is smoke-free policy in all realms. But I do like working closely with Peggy and Pete, Alberto as well, just because there's so much weight in smoke-free multi-unit housing. And what I mean by that is a lot of the disparities that we have identified at the state, we see a solution in those through smoke-free multi-unit housing. So I really enjoy this work, and you, like Peggy said, you will receive complaints from me. I'm not a robot, I'm a real person. And so if you have questions or if you're confused about what you see, please just reply back to me, and I am so happy to meet with you, meet with your team, walk you through the process of how to respond to a complaint. I'm definitely interested in supporting. So it was a little long-winded. I apologize. Like I said, I'm a little sleep deprived, but it's nice to see all of you.
Thanks, Rye. I know sometimes talking an adult after being with a child is like, oh, I got an adult now. Pete, just introduce yourself real quick and share what you put in the chat.
Yeah, Pete Bialik with Gaspa, Colorado. Nice to meet some of the new people. I'm with a group to alleviate smoking pollution, and I've been working on protecting people from exposure to secondhand smoke. Focus on, I'm subcontractor with Denver Health, where we work on smoke-free housing, but our organization is working on all phases of protecting people from secondhand smoke in any public place, workplace, or multi-unit or multi-family housing, however you want to say it. A few months ago, I updated our list of fair housing organizations that provide assistance to people who have problems with regard of anything related to fair housing, and definitely being exposed to secondhand smoke is one of those issues. And most of them said that if they're more than willing to help and use their resources. And so give them, if you can't get anywhere, that's another resource you may want to try. I did find out, and I do plan to meet with them sometime later this summer, that some of them are actually getting funding by the state to provide assistance in that way. So it could be a valuable resource for those who have kind of run into sort of a back wall and not being able to help these people at all. So and there's
Thank
a
you,
lot
Pete.
of other stuff on the website too, if you haven't never gone to My
Yeah.
Smoke-Free Housing, both for housing providers, residents, and also part of the website just for those of people that are working in public health.
Thank you, Pete. We do subcontract with GASP. They are our partners, so you'll see Pete in trainings and other calls. Please use him and his bountiful resource of his website as a resource for yourself. Let's jump back to Alberto now, and let's open it up to any questions that we have. I have a few, but I'm going to let you guys chime in first. Any questions that you have for Alberto about his process in Boulder or anything that he's been experiencing so far, please feel free to ask.
How successful have you been so far in any of the complaints that you've gotten since you've come on?
Well, depends on the nature of the complaints. If it pertains to secondhand smoking, I would say we are able to find some resolution within the limits of what TEP can do. So I would say only one or two of all the cases we've received this year so far, we haven't been able to really finish, so to speak. And in which some instances right now we're having one in which I've had to send to the complainant, we can no longer support you. We have referred you to the state so you can connect with Peggy and Raya should you have any questions. And there's others that, again, do not necessarily pertain to just secondhand smoke exposure, but rather it could be meth. So that is also something that we're exploring, because a lot of public health departments can have very nuanced methods for how to approach meth. So that's something that we're working on at this very moment.
Rye, I see your hand up.
Yeah, I just want to quickly chime in and add some clarity to what Alberto said about having those couple of complainants that he's had to say, you know, we've exhausted all options. I do want to reiterate that that is a last resort. Alberto, he put in, oh my gosh, months and months and months and months and months and months of time and effort, and Peggy put in months and months and months and months of time and effort with this constituent. And unfortunately, sometimes we do come across constituents that aren't fully able to grasp that the scope of the law is not quite as protective as what we wish it could be. And so that is when Alberto set that boundary, because it was leaning more into the person calling him relentlessly and things like that. So I want to just reiterate that that's not the first resort. We really do want to put as much effort in as possible to resolving these complaints, but there are times where that does have to happen. So Alberto, thank you for bringing that up, because I think it's a really important piece of all of this.
Peggy, you're muted.
Thank you. I want to just build on that too, because when Alberto told Raya, I said, just tell him you're going to elevate it to the state. She's like, what are you talking about? Don't have him grab me. She didn't say it like that, but she was like, what do you mean? And to me, it's that mental health component, right? Some of these folks are just this is their full-time job, is trying to end the secondhand smoke in their housing, and they're affected highly, and they have mental health issues, and they don't know how to let it go. So they call you at 10 o'clock at night, 8 o'clock at night, and they keep reporting the complaint when we've exhausted all of our resources. So that sometimes you need, instead of saying I can't help you, drop the ball, you have to pass the ball. So I've been doing this for 7 years. I'm a lot more jaded where I can tell people, no, you can't call me. That's not appropriate. You know what I mean? Like I can make them stop or at least give them another activity. So it is really just kind of, it's not appeasing them. It's just confirming with them that yes, Boulder couldn't help you. And now at the state level where they're at the top of doing it, they also are confirming that they cannot help because there's no law, right? So it's really not that we're going to do anything different. It's just we're going to talk about it more with them is what they need. And then we're going to try to clarify it for them while we can help them. Kenny, your hand is up. What do you have to say?
Yes, and this is a great project. Has there ever been a conversation with the housing association or any organized group of property managers to foster equity at the city council level?
Well, one of the things. Oh,
go ahead.
go
No,
ahead.
I just wanted to kind of clarify equity. Oh, are you saying like equity and smoke-free policies?
Yes.
Okay, Alberto.
In public housing or shared living environments.
Well, it depends really again of the public housing entity, because even though it's public housing, there is different administrative or like different management companies. One of the things that we're always talking about with, specifically if it's public housing in which we have a little bit more leverage, is okay, how is this policy actually manifesting? How are we making sure that people do not get displaced by this? How are we making sure that, we're understanding a myriad of disabilities and we're honoring that as part of the process? So when we speak with our constituents, we also say, well, these are other options to mobilize and to, if you need support with writing a letter to your local policymaker or your local representative, we're happy to support you with that. We also, when we talk about to management in public housing, usually it can be a municipality or it can be somebody who receives HUD funding. We tell them, it's like, make sure that this is also being enforced, that people know their rights. It's important to do signage that shows that, so that people can speak up about it, because it is within their right. And that's one of the things that we at least try to localize a lot, is making sure that you know what your rights are, this is how you can be mobilized, and that you have partners at the county and municipal level that can say, well, we can continue to advocate for policy. And that's one of the things that we're working currently with other TAs like Eric Underwood and Jenna Chan, is to say, well, we have new policy changes coming around secondhand smoking and marijuana. So how can we use that as an opportunity to fine tune that even better and potentially talk about equity implications, or how can we expand the protections for more people?
Thank you.
Really good question, Kenny. Just want to clarify for the group too. When we use the term public housing, it does mean something, right? Affordable housing means something. Public housing means something. So the meaning of public housing is a type of housing. So it is funded by the public, right? So that's going to be a HUD, like a HUD building or something that's funded federally. Now, marijuana use is not allowed in these federal buildings because marijuana is not federally legal. So we don't really talk about that a lot because it's just not allowed. So we can't talk about how to mitigate it, even though we do. And even now, and Pete will probably chime in a minute, but HUD has made also exceptions to some people using marijuana. And there's a whole bunch of rules behind that. But when we use those terms like public housing, affordable housing, those are housing types. And the only laws or the only protections we have in place currently are those public housing facilities, because they are mandated by HUD, which is their funder, to require a smoke-free policy and enforce it. So what we're looking at, Kenny, is are there ways to use that mechanism, right? The funders, can we go to the funders and talk about including that requirement in their funding opportunities? So we're going to go down that street. That's down in advocacy in about Q3. I'm going to cover that. I hope to use this series as a building process where we start at the beginning and we end up at advocacy and action, right? So great questions, and we're going to move forward in that way. connecting to finding ways to try to include some sort of mandatory policy requirement, which would be like a municipal ordinance or maybe even a local ordinance. I see Nikita's hand is up, and then we're going to just, if any, I'm going to transition to her presentation. But if you have more questions for Alberto, you can also ask those after Nikita is finished with her presentation. So I'd like to invite Nikita to first ask her question, and then to go ahead and just go into her presentation or her sharing.
Thank you, Peggy. So you mentioned that this is more about just like that. My question is about the housing types. So you said that public housing is funded through like the public and along with like the federal government. Is that what you said? Okay, and then it's also like, and so we're allowed to do like enforcement and stuff there for public housing because it's mandated by HUD, correct? Okay, and then so does that indicate that we are not allowed to do anything with affordable housing?
No, you can still do things with affordable housing. It's just knowing that when you go into like, it's kind of like the research part of the 5 R's. Research it and find out first, do I have any support here? Like, is there anything I can say, well, your funder requires it, right? So that's why you look for it, because it gives you leverage to use, you know, and be careful. And I'm going to do this again. This is more information for the future, but HUD has a, you know, you can report straight to HUD. If you have a smoking intrusion and you're being exposed, you can report straight to HUD. We have several people, I suggest this too, with the caveat of safety, right? Because there's always a possibility for retaliation. If you're funded by HUD and someone in your building is trying to disrupt your funding by complaining, that can be a sticky situation. So I do help people complain to HUD if they're not getting a response from their housing provider, with the caveat of just be aware of retaliation. And then we also know that the warranty of habitability protects against retaliation. So there are laws to protect them, but it's not saying it's not going to happen. So just to give you a heads up on that. So Nikita, the only reason we look at public housing and we want to make sure we know if it's public housing is that enforcement body that might help us, right, to put that over the top, to say, hey, your funding is at risk here if you don't enforce your policy effectively. So that would be, but in affordable housing, Nikita, we find that almost 90% of affordable housing is already smoke-free. Because communities demand it, right? 80% of people prefer smoke-free policies. So the large part of just market rate housing, they understand that the dollars and cents make sense if there's no smoking. It's the lower income, the high prevalence of smoking. Those are the buildings that really we want to concentrate on here. But definitely respond to all complaints that come in, no matter what building type they're in. Okay, Nikita, go ahead and share what's been going on down there in Pueblo. Is your screen frozen? Are you with us, Nikita?
Sorry, my internet connection is a little unstable. So we'll try to.
If you want to turn your camera off to give you more internet, that's fine. But whatever works best for you.
Works out. All right. So essentially, our system is very different from Boulder County's. And what happened was we first off, like we would receive complaints either from, well, primarily actually from the state. So any complaints that were given that we had are provided by them, but we also have a so for example, like Raya sends complaints and forwards it to us. And so essentially, I had attended the in-person training for multi-unit housing. I honestly don't really remember like the actual like name of the training, but it was in Denver. And I felt after that training, I felt very empowered to have like our own complaint system. And pretty much just to figure out like how to track them, how to properly just like how to build my knowledge about the complaints essentially. And so and the reason why I felt this way is just because Pueblo doesn't really receive a lot of complaints, or at least not consecutively. And so there are times where Raya could forward us like one per month, and there are times where we can get up to 5. So it really just depends. And so essentially, I was emailing Peggy, and along with my at the time coworker who was also working in this, pretty much just saying like, hey, how can we make our own system? And so basically Peggy went onto our website, just to pretty much see like what we had available, only to find out that half of it needed to be updated. And so that was kind of like basically saying that no one's perfect and that we all, that it was just kind of like our bad that it wasn't updated. But then we also realized that like we had kind of some like repeat information. And what I mean by that is like on the actual tobacco prevention website, which let me try to share my screen real fast. So hold on, I'm gonna stop sharing it and go to the right one. So essentially we had our own like we have our own website, which is this. And it just mentions like who we are, and then it goes into like what we do. And this has been updated, so this is not how it looked when we first met with Peggy. And so then, but basically what I wanted to do is make the website a little bit more user friendly. That way people like, because originally like it just provided like a whole list, like down this entire page of like resources that people could go for. So for me, I wanted to make it more accessible to people about like, okay, if you're youth, you click on the youth tab. If you're a parent or guardian, you click on this. If you want to quit, we provide quit resources here. And then the advisory committee is something that we're just starting up, so that was new. And then the Colorado Clean Indoor Air Act was actually on a separate page, so it was not on our page at all. And then we added stuff retail licensing just because, so these two, the advisory committee and the retail licensing, got added to our page because those are just the projects we're working on. And then About Us just kind of introduces myself and then my colleague Thea, who couldn't be on this meeting today, but basically just like tells people a little bit about us. That way they're not like, okay, who are these people? Who like who's the enforcement? Just that way, like to be more transparent with the community essentially. And then the extra resources are really to provide education and like fact sheets. So that's what our website looks like. And so then we found out that through to submit like a complaint or to go to find more about like smoke-free air, that was through our environmental health department. And so just to put it into perspective for you, the health department in Pueblo has 3 levels. And so where I'm located on the 2nd level. And then environmental health is located on the 3rd level. So just 2 completely different levels of the health department. And so essentially I found out that like, oh, hey, like, because at first we never really knew where the complaints went. So we knew that people were able to report a complaint on our website or from our website. But the issue is we didn't know how they were able to. We didn't know what email it went to. We didn't know what phone number it went to. We didn't know how it was being, I guess, processed. And so, and actually Peggy was Peggy pointed that out to us. And I was like, oh, that's an issue. Like we need to get that figured out. So that led us to meet with environmental health. And so we found out that environmental health actually has a website that they use called Health Space. And so essentially, I'm going to share this part of it just to like avoid any like information getting out. But this is what the dashboard looks like. And so basically it's like all we would have to do is go to complaint manager, which is right here, and then we would basically just fill out a complaint. And so what that includes is it's like a whole system. So it talks about like we would fill out so say we got like a complaint from like a pizza shop or something, and like Little Caesars, for example. We would put the information, that the address of the company or the business or whatever it was. And then pretty much from there we'd figure out, like, we'd put in all the other information. So what kind of complaint it was, we would put in like what the status of the complaint is. So how have we addressed it, or is it pending, or is it complete, things like that. And then and I would show you what I'm talking about. I don't want to I want to keep like the organization's confidential about the complaints that we receive, which is why I'm not sharing my screen. But if you want more information about it, you can feel free to email me. And so essentially that system allows us to put in everything. So even like we're even allowed to include like we can screenshot like the attach, or just screenshot the complaints that we receive and then put it in there. So it's kind of different than like making a like a kind of like with the Alberto system, and you can correct me if I'm misunderstanding about the system. But we don't really have to put it into like SharePoint or anything, or like a Google Drive. Like it's all there in that specific in that system, which is nice. And so if we want to as well to track how many complaints we have received, like tobacco, like because right now it's underneath tobacco, just because that's the simplest we could get it to be. But if we want to figure out how many complaints we had received in like a fiscal year, for example, or like a month or whatever it is, or I should say quarter, all we have to do is log on to it, and then we can like search for it. We can filter out the complaints to be specific to tobacco. And then from there, we can export it into an Excel file. And then that pretty much just gives us all the complaints. And then it gives us like all the information. So their address, how the complaint was dealt with, what the complaint was, things like that. And so we don't really have, let me back up. So we were able to meet with environmental health, which was awesome because we were able to develop that partnership with them. And we were able to figure out that like they both do and don't enforce like smoke-free air. It really just depends on what's in the code. And by code, I mean like the Colorado Clean Indoor Air Act, or if it's multi-unit housing. And so basically that's also really a part of like the research aspect of the complaints, is like you, so first when you receive a complaint, like you need to figure out, like read the complaint first, figure out who it's from. But also the location is pretty much key in determining how you're going to go about like approaching the complaint. And so you pretty much just have to research like, okay, so is the location specific to the Colorado Clean Indoor Air Act, or is it multi-unit housing? And so then basically like, we were able to figure out like how environmental health enforces it and if they're able to. And so then from there, I pretty much just asked them, I said, hey, like, can we relieve the burden from you and just like have our own account with, and the program is called Health Space that we use. And I said, can we just create our own account? And then basically like, instead of you all like primarily being the people who deal with those complaints, like, can we take that load on and then pretty much just like work with you if we need to? And they said, yeah, absolutely. Because like, who wouldn't want to have things taken off of their plate, right? So I figured that it was kind of like a no-brainer, and that they would say, yeah, totally, like take this from us. And so that eventually happened. And so now we're pretty much just like familiarizing ourselves with the platform. We've also updated our website, as I mentioned before. And so we were able to we were just able to like meet with a lot of people. So like our website technician, and pretty much just asked like for updates to be made. And then pretty much just we're able to figure out like, first we were acquainting ourselves with the platform. And so like, how do we properly report this? And now pretty much what we need to do next is because we don't really have like a flow chart, I guess you could say, or just like of like what to do next, so to speak. And so but you got to start somewhere. And so first it was the complaint system, and now we're pretty much trying to get into like what are the resources we can provide people with, like kind of universal ones, just so that way we can like create the template and then just like fill it out with like the date and the address and whatever it is, but then also creating that flow chart of reporting of like how to go about conducting it. That way, if like I were to leave tomorrow, the next person would understand how to go about this. And so we're definitely still a work in progress, but I am proud of the work we have done. And I just want to emphasize what Alberto said earlier. Just like really don't be afraid to ask for help, because not everyone knows everything. And my favorite thing to do is to ask questions. My favorite thing to do is bombard people with emails of questions that I have. And so I just like, it's super important to just ask for help, and literally no system is perfect. Like So Pueblo was very far from perfect, but I was thrilled when Peggy asked me to share about our experience, just because we're all learning and we're all going to be at different aspects of complaints and whatnot. So yeah.
Thank you, Nikita. That was terrific. I was worried there for a minute. I was like, blink your eyes and let me know if you're still with me when you lost your internet. I have, I'm going to ask a question here in a minute, but I think the work that you've done is phenomenal. Raya, do not tell Scott that she said anything about Pueblo. But it's not perfect, right? It is where it was when Scott left. And I love that you have built this internal process, that you've communicate with your environmental health team. This is what we're there for, guys. We may not be effective in getting rid of the smoke in the unit, but we can definitely move this forward. And most of that is connecting with our public health department to say, hey, we do this. And just like Alberto's kind of flow chart, when you create these types of documents and you create your system, it's so much easier to talk about your work internally, because all you have to do is provide a meeting with them for 15, 20 minutes and you lay it out. This is what we do. And like Nikita said, who doesn't want work off their plate? Like, hey, let me take that off your plate, and we're not giving them more work to do. We're trying to help them out with the process. So kudos to you. I'm going to open up to questions for anyone, to both. You can return to Alberto, or Nikita is happy to answer any questions if you guys have, or comment about our presentations. Okay, hearing no questions, I want to do a little clarification of, and then I do want to ask Alberto and Nikita a question. So when you get your complaints, they're just in a list, right? And so I noticed by the last drop, almost every county that received complaint had more Clean Indoor Act than they had housing. So I want us to understand, like, where are we with this support, right? So I'm going to talk about training in a minute, but if you can imagine a table, right? A table with 4 legs. When you remove a leg, what happens to the table? Tops over. Yeah. So let's think about housing in STEP as a table, right? So every leg is the stability of that program. So that is us, right? Secondhand smoke policy. That's us. That's what we do. But guess what? We're not a one leg table. We're not a round table with one stand. We have 4 legs. So we've included youth engagement. We're talking about community engagement. We're talking about policy advancement, right? Those are 3 other STEP TA areas that can support us, but we haven't been working in conjunction with one another. So we're changing that. We have a really exciting training coming up, another in person. Nikita, I'm very encouraged that you were encouraged by our training. Thank you very much for saying that, because it hit differently with different people. but we want to move forward. So we're having targeted training. Well, we're going to include all the other TAs so we can look at this holistically apart, right? But Alberto and Nikita, I want to ask you questions. We are finding, and I'm going to see if Bianca's on. I see Angie. Bianca, would you mind sharing your, you don't have to talk about the whole study, just share the insights that you received from your analysis of your Clean and Door Act. I mean, something, you know what I want you to say, right? What percentage of housing complaints were Clean and Door Act complaints?
We had about, oh, sorry, Angie and I are in the same conference room, so there's some echo.
It's okay. Oh, you're muted. Oh,
Can you hear
both
me
of
now?
you. Oh, yeah.
Okay, it's through
Yeah.
Angie's audio.
Yeah.
We're in the same conference room. So we had about 25% that were Clean Indoor Air Act, Colorado Clean Indoor Air Act, and then we had about, I want to say about 34% that were multi-unit housing. So we're still analyzing all of the findings from that, but it was pretty interesting to kind of take those cases, look at them over the past few years and see really what we could pull from it. And so that was one big thing that kind of stood out to us, was really the amount of multi-unit housing, but then also when looking at the different industries, the businesses, that was also really interesting. I know we saw quite a few bars and restaurants. And then the other one that stood out, I think, was manufacturing. Yeah, so those were the two. So those are just some high level findings that we have at this point in time. We're still kind of working through that, but it's been a really, really neat process to go through.
Thank you, Bianca. And thank you, Angie, also. So the reason I wanted to highlight that is because, so Clean and Door Act, yeah, it's a law. We have different processes than multi-unit housing, which is a voluntary policy, right? So when you get these complaints, you'll suss out which one is which, right? So Alberto and Nikita, how do you guys separate those, or do you, as far as your data collection? And just to highlight too, more often than not, hopefully, there'll be a Clean and Door Air Act violation within the multi-unit housing complaint. So that means like they're smoking within 25 feet of the door. And those little details are important to know, like where's the door and what's the, you know, those are a whole bunch of things that you'll have to suss out with your internal processes, and we'll help you with that as well. But to get support for Clean and Door Act, this is why the policy folks are joining us, because that's policy. So that's Jenna and Eric kind of go in that direction with the Clean and Door, and Raya. So we all kind of work together, but when it comes to Clean and Door Act, we're going to give you support for that outside of multi-unit housing, but do understand that inside multi-unit housing, there are still Clean and Door Air Act complaints. So Alberto, how do you differentiate the two in your reporting or collection, or do you?
Usually we describe usually in our tracking process. Sometimes I recognize that I haven't done that so clearly. And also when we determine whether it's private multi-unit housing or if it's public multi-unit housing, then we determine what the nature of it is. And also in our letter, I think the most important part for us is when we communicate to the responsible party or the enforcing party, we explain what is in violation or what they need to infract. So as of now, the most consistent way in which we've done that is through the formal documentation that we share out.
Perfect, thank you. So now we're going to do, does anybody have any more questions for the presenters before we move on to our engagement activity? Thanks, Raya. All right, so I'm going to break us up into, don't you hate, when I'm in a meeting and they say I'm going to break you out into breakout rooms, I just cringe. I'm like, oh. But I just want to kind of see how much we've we've digested from today. So what we're going to do is go into breakout rooms. Bye, Casey. And bye, Angie. Bye. See, everybody goes when we get to go to breakout rooms. So we're going to go into breakout rooms, and I want you guys just to high level develop a process to respond to secondhand smoke, somewhat like the process that Nikita and Alberto specifically have laid out for us today. So you want to concentrate. Let me just share my screen with you for a minute, just to give you the reminder of what we want to look at, right? So we want to look at this complaint process. We want you to develop a process, how you're going to receive, how you're going to research, reflect, respond, report. And so if you could jump together and just discuss, like, what kind of data are we collecting? What is our first move? What is our next move? And things like that. I'm going to give you, we're going to break out into rooms. I'm only going to talk about everything that we talked about, especially questions that you have. And then we'll convene back in, let's do this for, Alberto, what do you think? 5 minutes or 10 minutes? 5 minutes? 6, 10?
Yeah, and maybe we can communicate via chat if we need more time.
Yeah, let's start at 5 minutes. May go 10. I'm going to pop into each room and see how you guys are. But let's talk about a process. So remember, all the rest that we've talked about are going to come in the next Learn Community calls. We're just trying to start. We're at the starting point right now. So just developing a process. So here we go. Let me see if I can get you guys organized into breakout room setting. Oh, there we go. Sorry. I'm going to put, there's 11. Oh, there's only 11 people left. That's how many people are afraid of talking. Okay. So I'll only do 3 rooms then, since there are 11 people left. Okay.
Peggy, by the way, like 2 of the 11 of us are just the meeting like there's a random meeting
Wow.
notes person.
Amanda. Yeah, you know what? I'm
I
not going to
thought
break
that
out
Jason
rooms
was.
then. That's
Just an
so,
FYI.
thank you, Amanda. I see that now.
Yeah.
Okay. Well, that's probably not a very, that's not a very good activity then, is it?
Someone put like meeting guest is like us also in like together mode, but I don't know if that's a person or like read AI meeting notes is a person. So there are maybe
That's
8 of
my
us
meeting
total.
notes. Yeah. Okay.
Right.
Well, let's just not do that. I'm sorry. I thought it would be great. But hi, Donna. How are you? Well, let's just take a moment. If you guys have to jump off, please jump off. I see a couple of faces here that I didn't know were here. And so let's have a little conversation. Hi, Tracy. It's good to see you. I have a question about some of the complaints that just went out. Donna, you have some in your complaints that I found extremely interesting. Have you read over your complaints yet? Yeah, you're on mute. Unmute yourself. I want to hear your voice. I'm so bossy. Unmute yourself.
Oh, there I am.
There you go. Okay, so talk a little bit about the complaints that you just received. I haven't pulled them up yet, but I saw one and I was like, "Ooh, no!" So what did you find in the complaints you received this last dump?
Yeah, so I think so. Well, some of them were from June, so that's like, okay, that already means that we need a conversation about the delay in responding. Just like to be supportive as good customer service folks. But the big thing is that there were more clean indoor air complaints than we would normally have. We have done a lot of work over the years with our jurisdictions. Well, who knows? I don't know why we don't get as many clean indoor air act complaints as usual, but there were, or as others seem to, but we get more multi-unit housing complaints. And among that batch, there were a couple that really did also stand out, right? So like there was one about, I think the property was fully smoke-free. There are a couple that they specified that their lease or that there was a policy making their entire property smoke free, I believe. And then there's clear smoking. One of them really bothered me, and it was probably the one you were bothered by, maybe Peggy. And it was a person who said that they have a smoke-free property. They have a balcony, a person next to them smoking out on the balcony, like all day. Like it seems like it's pretty incessant, but they've got like some kind of wood divider between their balcony and theirs. I don't know if that's just like an accent feature, but it basically blocks them from seeing who's smoking, but they get the smoke drift not only onto their balcony, but into their unit. So they, are the smoke from the smoking on the balcony next door infiltrates their unit. And they went to their manager, and the manager said, well, you need to get a picture. You need to take a picture. So the things that come up for me right away is how that really creates problematic relations between the tenants. I mean, it's very unfortunate that the landlord would pit a neighbor against a neighbor like that. Maybe it's not pitting, right? But it's like that neighbor is clear that if they were to try and take a picture, it would be obvious they were doing so because of that cedar, wall thing. So I was already beginning to think in my head, if the property owner or manager is open to a conversation and it doesn't create some kind of risk to the resident who's the complainant, because of course there is that. And in our county, we don't have a registry. We have probably pretty we really don't have a lot of like consistency around supporting tenants who are making complaints. And we frequently in our county, calls are made to local PD, and the person who's the complainant gets tagged as harassing the person who smokes. So it's going to be a conversation to kind of unwrap this a little bit. But I was already thinking, what are the prospects that there could be an opening from the manager to look at some other strategies? And I was thinking, gee, I wonder what those strategies might be. Could we get a nicotine, like a clean air monitor, but that's a balcony, so it's not quite the same.
I love that. When I read them all, and then I'm like, well, this is what I would do. And I thought, first thing I looked it up is find out if the balconies are a part of the smoke-free policy, right?
Right.
Yeah. I mean, that would be, and I'm just saying that for the group. I know you know that.
Yeah.
But sometimes we jump in and we start already advocating for enforcement when maybe patios aren't even included in their policy. Right. So that's why we do that research, right? Is to research that thing. But also just, even if they just, if the building manager just required them to remove the plywood, as that would be a normal thing because you're not allowed to really have things on your balcony like that. But then that would be more visible about the smoke, they're hiding whatever. But I appreciate that. And I see Eric's on here, so I did want to talk about one more of your complaint, and I'm going to slide a little bit into Clean Indoor Act only because there are only us on this call. I saw that they were complaining about the ashtrays being too close to the Colorado Mills Mall. We get complaints about ashtrays being too close to the building. And if you look at the Clean Indoor Act, it doesn't address ashtrays location at all. And I always say, well, the problem is your ashtray is right by the door. So I always say move the ashtray. But there's no requirement of the placement of the ashtray. So Eric, I'm curious, since you're doing the Clean Indoor Act, how do we think about that? I would love to change the law to say no receptacles or smoking materials within 25 feet of the door, right? But how do you see that coming into play, Donna? What are you thinking about that one?
Yeah, I'm relatively familiar with the area, but one of the things that came up for me was actually helping them with some signage and getting the receptacles moved to the edge of the parking lot where there's like kind of that juncture, like they're now walking onto the pedestrian thoroughfare or the pedestrian walkway. So getting a signage and having them move the receptacles to that, kind of like access point on into the entryway. So we did that at Red Rocks Community College, like moved the receptacles to the pathways from the parking lot onto the walkway that gets into the property, and with a sign that says, whatever. And so we could help Mills Mall do that, and that would probably be multiple points in the in the property, but that was the thought that came to me.
Yeah, Eric, what do you hear? I'm sure you guys haven't been doing this for a very long time, so you haven't had the plethora of years of the complaints, but we hear that a lot about the receptacle. It attracts the smoker, right? I mean, I want to put my ashtray out and I'm going to put it in the ashtray. And if it's by the door, then I'm going to walk up to the door and put it out. I love your approach, Donna, at adding signage into that. But do you have any other insights, Eric, about how we could elevate that, maybe to higher, maybe to be included, you know, in the language with ever to keep in mind, but how to communicate to a housing provider or a business that their ashtray is the issue?
Yeah, can you hear me okay? I'm having some audio problems. Teams
You're
sometimes.
light. It's light, but I can hear you.
So I'll try to talk a little louder. Yeah, I think that, Donna, you know, on the case-by-case basis thing, that's a really great pathway to take because it's relationship building with the businesses and education, right? Like, I think that a lot of our local policy work starts there, especially when it concerns a state law that's applying to our localities. When we get into having our own laws in our municipalities or our counties, I think that writing into, per Peggy's point here, writing that language into the policy is a really powerful place to point if you're having difficulty with a business owner at that point. Like if they're saying, well, I don't need to do it, I'm going to leave it right here and go kick rocks, you know, that kind of thing, then you can show them the language. And I think that some of our smoke and vapor free laws do include that language for receptacles needing to be, or things related to the act of smoking needing to be outside of that buffer area. There are also expansions that we can consider for a 25-foot barrier around the entire building, business, whatever it may be.
Mm-hmm.
And there are other strengthening strategies within smoke and vapor free laws that we can discuss with folks to make sure that, you know, you're not hitting these roadblocks with having to have those types of discussions. And that's certainly a idealistic situation. It doesn't always work out that way, but at least you have something to point back to if it comes to that. So does that answer the question?
It does. It does. And Eric, after, I don't know if you were on for the whole call, but after being on this call, do you see the need for this collaboration between Colorado Clean Indoor Act and multi-unit housing? The distinction between the two, it is blurred with the newer grantees. And I think that training that we do that will specifically call out like what to do here and what to do there will help. How do you think we can better kind of engage the grantees? Go ahead, Pete.
Sorry, I just wanted to mention what we did many years ago. When we had problems at the Crossroads Mall. This is a long time ago. We actually wrote this into the ordinance where and we actually were able to get these signs that you could put above an ashtray that said no smoking beyond this point. And that was very helpful because when people see an ashtray, they say, oh, this is where I can smoke, you know, a lot of times. So having that really made a huge difference, and people would put out their cigarettes before moving past the point where they were not allowed to smoke. So just want to bring that up as a possible solution as well.
Yeah, any sort of signage, reinforcement of rules that can be made is certainly worthwhile. And thank you for sharing that, Pete.
Mm-hmm. Yeah, I like that. So anyway, my point is the Clean Indoor Act complaints are doubling. I've never seen such a thing before. And a lot of it is, you know, Eric, were businesses, everybody's vaping at work, you know, vaping. And they don't, even people that own the building, they're like, I own this building, I can do what I want. It's like, really? No, you can't. You have employees. So I think there's a whole lot of collaboration that we can do, with one another to strengthen that Clean Indoor Act. But I also want the grantees to know that there's possibility for this local municipal ordinance. Like, you can do things locally that can protect individuals, and you not have to wait for a national law or a state law. We found that in Longmont, they had that 15 feet rule, but that was just enough to get the smoking off the patio, which was the front entrance, right? So I love moving forward in this collaboration to find out how we can not only strengthen the Clean Indoor Act as we move along, but also bring housing up to that level, and to try and find ways to, include housing or some supports for housing, even at the local level if possible. All right, guys. Well, that's all I have for today. Does anybody have, Tracy, it's good to see you. How's American Lawn doing?
I can't hit the right buttons here. American Lawn's doing fine. I'm doing fine.
That was just a test for you to see if you're paying attention. No, I'm kidding. Sharing the screen can be quite difficult sometimes. Only, thank you so much for staying with us in Lincoln County. I do want to share with you guys, we're in our trainings we're having across the state. We've got 3 locations kind of pinpointed. We're looking at the 3 corners of Colorado, and then hopefully that little eastern, northeastern portion. Northeast is a very strong public health department that we've included. There's not a lot of grantees around them. So if you have any grantees that are interested in those areas and are interested in hosting with us, we hope to facilitate the trainings in collaboration with the grantee in those locations, so we can have more of a collaborative effort, and we can all be together. So anyway, that'll all come out in the STEP newsletter. I did want to share, right before I leave, a new study that I wanted everybody to read, but I'll just share it with the ones that are here because I really do like it. You know how when sometimes you're looking for the right study, and then one day this new one comes up and you're like, where did that come from? And that's this. Let me just put this in here. So the name of this study is, what was it say? Something like I pay my rent and I want to smoke. So it's a really interesting study. It has a lot of really good just baseline knowledge, and it kind of reiterates some things like designated smoking areas and things like that for low income. So I think it's a good read. And the information wasn't new to me, but I love when I find a study that points to what I want to say. So anyway, okay, does anybody have any questions or concerns before we say goodbye for the day? All right, you all think no breakout rooms anymore? No more breakout rooms. Have you ever had that happen, like already breakout rooms, and all of a sudden everybody leaves? It's like, okay, yeah, that's fun. Okay, live and learn. All right, guys, it's great seeing all of you. I'll see you the next time. The next Learning Community Call is November the 14th. All right, I'll send the invitation out. Thanks for joining me. Bye-bye.
Thank you all.